Only on ABC 12 tonight, the CDC says McLaren Flint has been a source of Legionella bacteria growth for more than a decade. ABC 12 uncovered the letter saying the hospital has been a source of the bacteria since 2008. We first told you about issues with Legionella at the hospital back in 2014 during the water crisis. The state reported 90 people contracted Legionnaires disease in 2014 and 15, saying McLaren Flint Hospital was the common source for those cases. In documents we've uncovered, the CDC says it's been an issue at the hospital 6 years before the city switched its water source and was still connected to cases in 2019. Our Ann Perrette uncovered this information and has those details only on ABC 12. Joining us now live from McLaren Flint. Ann, why are we learning this information 13 months later?
That is a question I have been working to answer. This letter is dated December of 2019. I just received it this week from a former state health director who says he obtained it after defense attorneys in the Flint water criminal investigation accidentally got a hold of it.
I've been sitting on this for several months, and it's been gnawing at me that this has not been put out.
Jim Haveman served as the state health director under Governors John Engler and Rick Snyder. This week, he sent me this 47-page letter from the CDC to MDHHS dated December 2019. The letter was never made public, but Haveman says what's included in it should be public knowledge. He didn't want to undermine the current state health director, but says he's waited long enough.
So the question to me as a citizen, I'm not a physician, is why wasn't questions raised about, hey, McLaren, what are you doing?
In the letter, an investigation of healthcare-associated Legionnaires disease in Flint, the CDC says from January 2018 to June 2019, 5 people contracted the illness, and they confirm 1, but believe all 5 are connected to McLaren Flint. 2 of those people died. We first reported in June of 2019, the state health department and state licensing agency issued orders requiring the hospital to address this risk. We've now learned the CDC came to town to investigate, and this letter breaks down what they found. It states scientific review, quote, raised concern that conditions supporting Legionella growth may continue to exist within the facility. The CDC also repeatedly points out, quote, a particular strain of Legionella identified in the McLaren Flint water system has been associated with the disease for more than a decade, dating back to 2008, 6 years before the city's water source switch. So the CDC states something needs to be done to, quote, eradicate this outbreak strain from all building water systems in order to protect patients, visitors, and staff from exposure to Legionella. While on the ground in Flint, the CDC investigation team reviewed the hospital's water management program put in place in 2016. The conclusion, the letter states, McLaren Flint focuses on the hot water systems, which is reducing the risk of Legionella, but not eradicating it. And, quote, when Legionella environmental sampling has been expanded to the cold water system in the course of case response or efforts to investigate issues at points of use, Legionella was detected. The letter states ice machines, faucets, and shower heads have tested positive for the bacteria, and so have drinking water fountains. A concern, quote, it is possible that the drinking fountains could be contaminated between the filter and the point of use, meaning that the inline filters may not be preventing Legionella transmission. 5 pages of recommendations from the CDC follow, including the use of point of use filters, taking ice machines and water fountains out of service until they're disinfected and tested. Test all patients with pneumonia for Legionella. Train clinicians on how to diagnose and treat Legionnaires disease. The CDC also provided guidance to their water management team to strengthen their testing measures. And the CDC makes it clear that it's up to the state to make sure that those recommendations are followed and make a difference in eradicating the risk for Legionella growth and transmission. I have reached out to both the state and McLaren Flint to find out 13 months later, is the hospital still considered at risk for spreading the bacteria? Those answers tonight at 6. For now, live in Flint, I'm Ann Perrette, ABC 12 News.
And thank you. As Ann mentioned, this report says 5 people contracted Legionnaires. So let's take a look at those cases. The 5 patients ranged in age from 50 to 70 years old. 3 were women. All 5 had chronic underlying illnesses, and they all required inpatient treatment in the ICU for Legionnaires. Sadly, 2 died from the disease.